All right, so for cervical range of motion, we have cervical flexion, cervical extension, we have lateral side bending, right and left, and then we have rotation, right and left. I feel like these are actually fairly easy, so hopefully you do as well. The first one we're going to start with cervical flexion extension. Your axis is the external auditory meatus, so your ear hole. Your stabilizing arm is either, you can choose either perpendicular to the ground or parallel with the ground. It's either is fine. You just need to remember which you start with because that will change how you look at the numbers on your goni. And your moving arm is the tip of your nose. So I'm going to be sitting next to my patient. Let me see if you can actually still see if I sit on this side. Maybe not. Okay. So I'm going to be, you can either sit or stand next to your patient, whichever is fine. High-low tables, make sure your table is down so that your patient's feet are flat on the ground. So axis, again, fulcrum, whichever you want to call it. Ear hole, external auditory meatus. I like to keep mine perpendicular to the ground. That's just how I like to do it. Like I said, you don't have to. And then I'm actually using the red number because when I have my moving arm parallel with her nose, that red 0 on the outside of my goni is the number I'm looking at. Does that make sense to everyone?
Yeah.
So know which number you start with because you know, if I'm starting at 90, the black number says 90, and then I have her move down to the 120, she doesn't have 120 degrees of flexion. I need to know that 120 minus 90 equals 30. Does that make sense? So just, you need to be aware of the number you start with or which number you actually need to look at. So the instructions you're going to give your patient are just looking down, bringing your chin to your chest, because you don't want them, compensations for this, they can start rounding their shoulder, they could start flexing that whole upper back. It's just chin down to your chest, looking down to the ground, and then same thing, looking up to the ceiling with your eyes, and you're following the nose. Normal flexion is 50?
Yes.
Extension is 70? 75, almost. So again, expressing those normative values. Okay. Patient, can you, and then can I have you pull your mask down just below your nose? Thank you. So I'm going to have you have that moving arm lined up at the tip of their nose. Can I have you look down towards the ground, please? Thank you. Any pain, discomfort, anything there?
No.
And she is at 24 degrees of cervical flexion. You, again, same thing with the range of motion. I messed up because I'm going to have her do it. Look down. Good. Come back. To me, that looks like about 20 degrees on the first. When she comes down, you can give a slight overpressure on the top of her head. To me, that's a firm end feel. And that's with that slight overpressure with the head, same thing if you look up. Can I have you look up? You can just kind of give a slight overpressure on that forehead. With the neck, you can relax. With the neck especially, you don't want to yank on them because there are a lot of sensitive structures, especially in the cervical spine, so you don't want to like jam their head back. Just a slight overpressure to determine that end feel on the first rep. Same thing if she's, can you bring your right ear to your right shoulder? Doing, yep, side bending, just a slight overpressure on the side of the head, and rotation, can you look towards me? Just a slight overpressure on that head. Because same thing, this is, even if it's the neck, you still need to get that end feel, estimate your range of motion, et cetera, et cetera. Does that make sense?
Is it a firm end feel for all of them?
It's ligamentous firm end feel, yeah. And I think we mentioned this last weekend. Later on you'll get more into what that firm end feel is, if it's capsular or ligamentous or whatever. Don't worry about that now. Just soft, firm, and hard are the only three things that you need to worry about for now. Okay. So again, I'm gonna have you look down, or I look down, she looked like she's about 30 degrees. I'm gonna preset my goni. I'm using the red numbers. Can you look down again, please? Lined up with the external auditory meatus, perpendicular to the ground, looking down towards that tip of her nose, and she's actually 26 degrees. Any pain? Good?
Black.
Any questions on cervical flexion? Cervical extension, same position. Can I have you look up towards the ceiling? A little bit of overpressure, firm end feel, any pain there?
Nope.
She looks like she's about 70 degrees. Normal is 75.
Yes.
Pain, anything there? So I'm gonna bring her from 0. I'm gonna preset my gonio to 70. Looking at that external auditory meatus, and she's actually at 58. Flexion extension, good? So for lateral side bending, you're actually gonna be facing your patient. The fulcrum is the tip of the nose. Stabilizing arm is like parallel with the sternum, or in line with the sternum. And the moving arm is going to be between the eyebrows. Does that make sense? So you're going to be like this, tip of the nose, parallel with the sternum. And the reason you want to be parallel with the sternum is because sometimes patients will start doing this. And if you stay parallel with the sternum, you're better at catching any compensation. Because you're not stabilizing the patient so much when they're moving. So parallel with the sternum and then in between the eyebrows, just because every patient, sometimes they might have like a crooked nose or something. Okay, so patient, can I have you bring your right ear to your right shoulder? Good, any pain there? It's a firm end feel. That looks like it's about 30 degrees, normal should be 45.
Yes.
Just tight everywhere.
And then this is again is a kind of a weird angle because of the table, but you want it, your eye level should be level with the tip of their nose. So keeping here, and you are at 27. And same thing to the left side. Patient can bring your left ear to your left shoulder. Any pain, discomfort there? Still okay? Okay. That looks like it's about same 30 degrees to me. Tip of the nose, parallel with the sternum. You're at 30. Good on lateral flexion. Questions before we move on? So then the last one is the lateral rotation. This is where you're actually going to be on the table, standing above your patient. So, excuse me. Oh, I see I'm behind you. Can I scoot forward just a little? This especially helps when your patient's feet are on the floor because then you have a little more room to stand without dying. So fulcrum is just smack dab middle of their head. The moving arm is their nose, so you're gonna watch their nose moving side to side. And then stabilizing arm is just perpendicular to their body, so perpendicular to the thorax. You do wanna make sure some of the compensations here is that they could start turning their shoulders right and left. So watching that to make sure they don't, and if they do, then that stabilizing arm is going to follow, staying perpendicular to the thorax. Does that make sense? So then my cue to my patient is, can you please look over your right shoulder? Any pain there?
No.
Firm end feel. That looks like it's about 80 degrees, normal is 70.
Yes.
Okay. So I'm going to preset my goni, have them go back to that end and range. Good. And she's at 78. So relax. Same thing to the left. Can you please look over your left shoulder? Any pain there?
Nope.
Gentle overpressure. She looks like she's 80 again. And then I'm gonna look for the middle of the head, and she's at 76. Okay. Questions about cervical motions? Flexion, extension, lateral side bending, rotation.
So when you're having them do the motion, like to estimate what you're gonna see for the Goni measurement, and you're applying slight overpressure, so is that like an active range of motion that they're doing?
They're
And then
doing
you're
for
just kind
cervical.
of-
They're doing active range of motion, but the overpressure